So first, I'll introduce Dr. Lipskar, who's a pediatric surgeon out of New York City, talking about contract negotiations.
And I'm just going to add that Aaron Lipskar is a perfect person to give this talk because other than being a good friend of mine, he's really just been through this process of starting a practice, and he'll tell you about his personal story, but it's great to hear it from someone who's actually going through it as we speak.
So thank you. It's my honor to be in the last session and see the humongous crowds we attract for these sessions. And thank you, Brian and Dr. Roller, for inviting me to take part in this conference. It's always fun when IPEG and SAGES are together. I guess it's every 3 years we do it that way. So this is a great topic, and like Brian said, I have a personal story that I'll share at the end, and I also just went through the process because I'm a few years out of fellowship. I have no real disclosures except my wife is a contract and employment attorney, which is helpful in gathering information on topics like this. So I'm just going to go over quickly the scope of the issue, the job hunt, the first interview, the additional interviews, the contract negotiations, and then share with you some of my thoughts and my story. So we're after all this training, 5 to 7 years of general surgical training, and then beyond that in fellowship, we're well trained. See one, do one, teach one, become a regulator. We're ambitious, we're idealistic, but nobody trains us in career development and how to navigate our job hunt. Where do we go for help? You know, the professional societies is actually a great resource. The ACS and the AAS have provided a tremendous amount of support. I actually brought a handful of flyers. I'll put them in the back at the end. The AAS has a course for career development for residents and fellows and junior faculty on how to go do all the things that I'm talking about today. The ACS has a transition to practice pilot fellowship program that are being implemented in residency programs. And specialty societies like SAGES, APSA, ASCRS all participate in training their fellows and young surgeons how to go through this process. Our mentors are critical in understanding where to go for help, our peers, and of course the most important one on the list is our families, because they're the ones that are going to be there at the end of the day for us. And the job hunt shouldn't just be like, let's see what happens. There's really 3 stages in the process. You look for a job, you screen the opportunities, and you craft the position. So there's 3 basics that you have to figure out when you're looking for your job. One is geography. The other is who you want to work for, which is a fascinatingly changing field that the ACS has really been focusing on as the trend that most of us as young surgeons are institutional employees to hospitals. And the last is really something I want to focus on a little bit is what do you want to be when you grow up? My first job, I was 39 years old, and I was asked what I want to be when I grow up when I was a little kid, when I was in high school, college, medical school, surgical residency, and you still sort of have to figure out what finally, after years and years, you're an adult and have to decide what you want to be when you grow up. So that job hunt really requires a significant amount of soul searching. Geography is about family, is about job opportunities for spouses and schools for children, real estate, religion, social life. This can be researched, and some just know because of where they're from, but the details can be found out in an interview. Where you want to work for, I'm not going to spend a tremendous amount of time on. Like I said, the ACS has actually released a document called Surgeons as Institutional Employees, as the trend has been that the majority of surgeons end up as institutional employees these days, and large group practices are uncommon, and small group practices are even less common. And the soul searching, like I said, is where I would want to focus a little bit. And I think everybody has to make a mission statement for themselves. Try to detail your motivations, your methods, your goals for 2, 5, and 10 years. Address your clinical interests, your personal interests, your leadership goals, your roles in education, and a research plan and structure if that's what you want. Will you be, and I put in quotes, academic? And if you do want to be academic, what does that mean? I think the definition of academic is that you want to spend some time of your career away from managing an individual patient and trying to fix a problem in medicine, whether it's the wait in the ER or the long delay between cases or the full Fox pathway of neuroblastoma. If it is academic, do you want to be a clinical surgeon who publishes? People call that a surgeon educator or a clinical scientist. Or do you want to be a primary researcher who sees patients part-time? What are your stretch goals? What achievements in your career will really set you apart? This list can go on forever. Is it financial success, clinical expertise, surgical innovation? We're at SAGES, so we focus a lot on innovation and techniques here. A New England Journal publication. I mean, we can make this list as long as we want. But ultimately, you have to identify the flexible and the non-negotiable elements in your mission statement, and then you're sort of ready to start the hunt. But where do you find the opportunities? And it's not in those want ads in the back of New England Journal and Jack's. It's going to be from word of mouth. It's going to be from mentors and connections. And it's going to be from professional meetings where you seek out the people you admire. And they're always happy to talk to you. And sometimes you end up with a job with that. And it's a really nice way to start the hunt. So then you've begun and you go to your first interview, and you know, it's an intimidating thing, especially as your first job, right? What do you have to offer? But you have to make them want to hire you, and you have to decide if you want to be hired by them. And you have to remember that you are interviewing them just as much as they're interviewing you. So some basics about interviewing: be confident, be professional. Do not schedule interviews post-call. If you're a fellow or a resident, it's just not worth it. Wear professional, clean, and pressed clothes. These sound really silly, but it's worth it to just go through these. Avoid colognes, perfumes. Bring copies of your CV, interview questions. Bring extra pens. Put your cell phone and pager on silent. Greet your interviewer with a firm handshake. Maintain eye contact. Use the interviewer's name early and frequently. And be polite and professional with all the associates and staff. Maintain your focus, answer what's asked, discuss your goals and interests. Remember, they have a copy of your CV. You don't have to reiterate every detail of it. Sell your enthusiasm, qualifications, expertise, and strengths. And if you think you're talking too much, you probably are. And then, you know, lastly, before some details of the interview, do your background research on the hospital and the practice. Be ready to answer questions and be honest. And be ready to ask questions. So what questions will you be asked? I'm going to go through these quickly. And these are not, obviously, all-inclusive lists. Why do you want to join our practice? Why do you think you'll fit in here? What can you offer us? What experience have you had in blank? Where do you see yourself in 2, 5, 10 years? What are your strengths? What are your weaknesses? What questions can you ask? So the goals of asking questions are really threefold. Would you like being part of this practice? Would you fit in easily into this environment? And will you be treated as a respected and valuable colleague? So you can ask, I mean, again, not an inclusive list, but a long one. What's the practice mix? What expertise are you looking to add? What will my role be in the practice? What will my responsibilities be beyond patient care? Will I have dedicated research educational time if that's what you want? What's a day like? Will I have block time? Will I have input into administration? Do you have satellite offices? What kind of marketing or practice building activities do you plan for a new associate? How many staff members do you employ? What's the turnover of the staff members? Will I have my own dedicated staff? How does call get handled? And this list can go on and on and on. And what shouldn't you ask in that first interview? Money talks. All right, and if you are asked about salaries, you try to get away from it in that first talk. There'll be lots of time in your additional interviews to go over contract negotiations and money talks. But most important in that first interview is looking around, and you'll see another quote from Yogi Berra later, because he's like the greatest quote man in the world. But you can observe a lot just from looking or just from watching. So when you're at an interview, look around, look at the physical structure. Is it clean? Would you want to hang out in the waiting room? Would you want to wait in the pre-op area if you or your child, I'm a pediatric surgeon, needed surgery there? Are things organized? Are people nice to each other? Look at the OR schedule. Is the OR being utilized correctly? You can learn a lot about that place just from looking around. And ending the interview, you have to establish clear communication regarding follow-up. Whose role is it to follow up? Is it your role or their role? Weigh the facts and impressions and listen to your gut. If you leave an interview and you don't feel as though it's the right match, it's probably because it's not. Send a thank you note to somebody. It's sometimes a really nice way to break up with them if you don't like them. And set up a second interview. So the additional interviews, you bring family. You meet everybody you missed the first time. You do not meet somebody in a group. That's a no-no in this field. If there's a group of 10 surgeons, you meet all 10 of them, and you don't take the job until you've met every single one of them. Keep your eyes open again, and then you start asking the difficult questions. And those difficult questions are about base salary, bonuses, incentives, terms of employment, partner tracks if you're in private practice, tenure tracks in academic practice, benefits. And I'm going quickly through this because this obviously segues into the contract negotiations, vacation leave, relocation and moving costs, time for CME, professional membership dues. These are the sorts of questions that you can bring up in a conversation. If you're going to have a lab, who will your mentor be? Where's your financial support? What are your benchmarks for research success? So it all goes well, and you've done these things, and you've talked, and you want to take the job, and you get a job offer, and then you get a contract. And now, you know how to take out a spleen through the, urachus remnant. I mean, you can do bizarre things to a human being after all of your training, but a contract is a scary thing. Like I said, my wife's a contract employment attorney. I just signed things. We bought a house, and she kept on reading all the pages. I said, this is going to take 12 hours if we read these pages, just sign. But there's a lot of information in this contract. I wanted to read this statement because it's in that ACS Surgeons as Institutional Employees Handbook. And the important parts of this is that to know that the ACS as a policy statement has made it clear that they recommend that every single surgeon hires a contract or employment attorney to read their contract before ever signing it. How many of you that have had their first jobs had an employment attorney review your contract before signing it? So that's about 20%? I think that's pretty high in our field. I think a lot of young surgeons see their contract and just sign it. And why is that? Because it's scary, it's overwhelming. There's a wide variety of them. We're often told that these are just boilerplate, these are non-negotiable, that there's nothing you can do about the terms of your contract. So retain an attorney. And the other thing we do terribly in our field is talk to each other. There's no reason we shouldn't be sharing with each other how much money we're making and what's in our contract so we can all benefit from it, especially as young surgeons. So just some employment contracts 101, there are only a handful of things that are in a basic contract, term and termination. Your term is how long you're going to be working there, usually 1 to 3 years. You need to know whether there's an automatic renewal provision or not. Termination is critical to know what the ability to terminate with cause and without cause is. What are the duties of the surgeon? Do you have required licensure, staffing requirements, call requirements, hospital privileges? What are the duties of the practice, office space, equipment? This is all in a contract. What other outside activities? What are the additional considerations for academic employment? What are the covenants to not compete or the restrictive covenants? And this is a really tricky one, right? Because these are really scary depending on where you live. We live, at least the three of us here live in a very saturated part of this country in New York where restrictive covenants cover 20 hospitals that involve what we can do next if we leave our positions, and know what they mean and how they get withheld. But if for those who don't know, a restrictive covenant or non-compete clauses do not allow you for some period of time to work in a designed geographic or by institution area. And the medical liability tail, which is more important as a young trainee. You don't realize this, but most of our medical malpractice is covered, but it's more common for the liability tail to not be covered, and that would be in your contract. And then, of course, what's not really in the contract, but is very important to us, is our compensation and benefits. Do we have a guaranteed salary? If so, for how long? Is it a base salary plus productivity, an RVU plus productivity, incentives, bonuses? The benefits are health insurance, malpractice, life insurance, payments for our dues, licenses, journals, time for vacation, retirement packages. So, it can get overwhelming, and hire a lawyer. And everything is negotiable, sort of, because it gets very complicated. And this is a nuance that my wife actually taught me, again, this isn't legal advice, but the fact that if a hospital has a contract that they do not usually make changes on, although if you hire an attorney for something, you could probably change it, the hospital will remember how difficult you were in changing that clause, which may make it harder to get rid of some of the other clauses in that contract. So it's a little bit of a tricky balance, and obviously I'm not an attorney, so I'm not going to get into the details of that. But I will share some closing thoughts. And there's really two closing thoughts. One is another Yogi Berra quote, which is that if you don't know where you're going, you might wind up someplace else. And I think that that's just goes back to the soul-searching part. And that leads me about what Dr. Jacob alluded to, which was my story. And I finished my fellowship 2 years ago, and I took a job, and it was not the job that I wanted, and I was unhappy with my job. And over the course of after 6 months of being at my job, I had a sense that this wasn't going to be a long-term solution, and I wasn't pleased with the promises that I felt like I was made and the outlook of the position. So I ended up with a fantastic opportunity at another institution, and have been in negotiations and I'm leaving. So I've learned a lot about my own soul searching and how this process goes well and goes poorly, and how important it is for us to learn how to do this in a healthy way and how undertrained we are in it. And then the last thought, my last sort of cartoon, which is, please don't think of my extensive list of previous jobs as job hopping. I've actually never quit a job. Remember, the average time a surgeon stays at their first job is 3 to 5 years. That's at least true in the pediatric surgical literature. I don't know if that's true in adult surgery. But it's very common to start your career and then realize that that wasn't the right first move for you as you're figuring out what you want to be when you grow up. And leaving your job once is not a problem. Job hopping becomes a problem, but that's a few jobs down the line. Well, thank you for your time. I'm sorry if I went a little bit over, and I'm happy to take any questions.
Aaron, that was terrific, and while I'm speaking, if anyone has a question for Dr. Lipskar, please come to the microphone. One of the things that I did with contracts, I've been in the same job since I started, but with each paragraph, I asked them, why is this clause here? What in real life made you write this? And that way you learn about what they're worried about, and then you can better figure out how to do something else. And instead of trying to change the contract, what you can do is say, okay, they're really worried that I'm going to build a patient base and set up shop next door and compete with them. And instead, just write a clause, I will not, for 1 year, write it. And make it very specific and translucent. But can you tell the audience anything that happened in your contract that changed in your first 2 years of practice that made you maybe want to switch directions or pivot? Did you think one thing? Did that come back and haunt you?
Well, it's a hard question. I guess the easy answer is that from my own experience, my first job was to have a basic science lab and had excellent financial support. And it gets into a question, and it's very hard to make this into a contract of how time is protected for a clinical surgeon to spend time away from their clinical work. And the reason that it's complicated is because sometimes it's surgeon-driven, and the surgeon takes responsibility for unprotecting their protected time. And sometimes it's a mentorship or track record of an institution. So it's not a necessarily, there are percentages of time there were in my contract that were not being withheld, but it's hard it depends on where you are and where your institution is. So I think that for my own reasons of changing jobs, it wasn't about problems with my contract. I don't think that my institution did anything against the contract that I had. It was my own happiness, and I think that sort of supersedes any legal documents. And for the most part, at least my experience, is that the human interactions have been more important than the legal interactions or the potential breaches of my contract that I went through.
And I would endorse that. So. And you gave a wealth of information. I mean, that was really phenomenal. When you talked about the interview basics, and if you've ever interviewed somebody, ultimately you almost don't even look down at their CV. What you're trying to determine, you'll hear this later, is the likability factor. Is this someone that I like, and do they like you? And it's almost like a first date. You know within the first 2 minutes. And I think that's very important. So the best thing to do is be yourself, they be themselves, but ask yourself, do you like that person? And sometimes the answer is no. And if the answer is no, think twice about the job. Any other questions for Dr. Lipskar? How many people are out there in the audience are in training? And anyone getting ready to change jobs or take a new job? So this is relevant stuff. So if you have questions about your own personal experience, don't feel shy. One question.
So I don't know if this is jumping the gun and maybe someone else will address it, but do you have any advice for someone looking to renegotiate a contract? I'm about 2 years into a 3-year contract for my first job. And how does that renegotiation take place, especially if you want to stay at your place?
So I don't know if someone else is handling this per se. Obviously I don't have personal experience in this. In my research on the topic, the one thing to make sure is that in your current contract there isn't an automatic renewal clause, because that's often in that initial contract. And if not, I can't speak directly on the details of renegotiation. I don't know if anybody else on the panel.
So I've done a little bit of this. Is this thing working?
Yeah, we hear.
All right. The most important thing is to know how much you're worth. And so what I find is that a lot of surgeons are on some sort of RVU-based compensation formula, and they can count RVUs, but they don't know what that means in terms of dollars. So I'm in private practice. I make what I make. Whatever we're able to bill and collect is what I make, minus my expenses. And so I know what I'm worth. On the front end, as I was setting up a bariatric program at the place I went to, we were able to establish self-pay prices for bariatrics, let's say, but the hospital, probably in hindsight, regrets doing this, but we were able to go through and track a patient on what the costs were for this hospital stay. So I knew exactly how much they were making on my surgeries. And so that's what you need to know. You need to know what you're worth. So what I was going to ask about RVUs. Is that Medicare-based RVUs? What if most of your payers are commercial insurance? Then you're getting screwed. But if most of your payers are Medicaid and unfunded, because you take a bunch of Call and stuff, then Medicare RVUs are actually pretty good. So you need to know how much you bring in. And I find that a lot of surgeons on the RVU-based formulas don't know how much they actually make, because that's some other department in the hospital in the basement that does the billing and the collecting. You just get a check, I did this, oh. And so to really effectively renegotiate, and usually what people want to renegotiate is for increased reimbursement. I want to get paid more for the work I'm doing. You have to start with some sort of basis of how much your work is actually worth. And then you can go back and say, I did this, this, and this, I made you this much, this is what I want.
We're going to move on to the next talker. You have a question? Dr. Lipskar, one more question.
Sorry, Art
No,
out of
please.
Cincinnati. Excellent talk, thank you.
No problem.
Just real quick, I think the most important act for you when you first take the first job, this is based on my first position, develop an excellent relationship with your billing people. Because if you go to your boss and say, show me my RVUs, they're going to show you some handmade Excel sheet with numbers that make you look like you're costing them money. So that when you go to negotiate, they're losing money on you, so they're not going to give you what you're worth. But if you develop a good, professional, strong relationship with your billing people, and they give you, let's say you go to them and say, hey, can I have a list of all my procedures that I did for the last year? And then all my critical care billing or whatever it is that you've done. And then you actually have the numbers. And then you say, hey, do you mind adding a column with RVUs? And then all of a sudden you have your RVUs. And then you go to MGMA and you say, here's the average RVUs for 50% MGMA salary in this part of the country. Then when you go to negotiate, say, hey, why are you giving me 5 percentile MGMA? Here are my RVUs. I'm doing better than median. And if you don't have that information, or you're being given the wrong information, or they're blocking you from having that information, maybe you shouldn't stay.
If I just, I think that's a great comment, and I want to add in probably some of this is my own idealism, and some of this is the field that I'm in, which is a very different field in terms of defining your existence based on your RVUs because of the payer mix in pediatrics and because of the sort of way the field works. But I would also say in that first job in advice that has paid off tremendously for me, and I don't mean this to pat myself on the back, but is going to be important in what we do, is do a good job at what you're doing and treat people well. If things happen and there's changes that need to be made, it makes it much easier to be done in a world without animosity. And it's very uncomfortable. These legal issues that show up in your contract and contract negotiations almost never come to a head if there's friendly and meaningful relationships between the parties.
That's great. Thanks again.